Hi, good afternoon, everyone. I'm Dr. Jun from Rubik's Clinic. Thank you for joining us today for our Facebook Live.
And I'm Dr. Melissa. Hello to all and good evening. So, welcome to our live session today. So, October is actually the month of pinkiness, okay, or we say the pink October. Why? Okay, so it's actually the breast cancer awareness month,
Yes.
okay, so it's actually a month to remind us that we have to take care of our health, especially for women. So, how we can actually help or prevent or even help people around us to prevent this cancer.
Yes, exactly. So today our Facebook live topic will be regarding breast cancer. Yeah, which is we want to unveil the truth between the estrogen and also the breast cancer risk, because there's a lot of women, yeah, is afraid of estrogen, yeah, because it's often linked to like breast cancer risk. But what it actually does and how um, it act on our breast health, this is what we're going to undiscover today.
Yes, definitely. So, estrogen is actually not an enemy to us women. So, it actually makes us more happy, confident, more energetic. So, what we want to discuss here is actually how we should maintain the balance between the estrogen and progesterone, which are the important female hormones in us women. So, we will explore further into how our lifestyle, stress, gut, liver health can actually affect the balancing between estrogen and progesterone.
Yes.
So let's start with estrogen. Okay, estrogen, as everybody knows, is a female hormones. Okay, so there are many roles that estrogen actually play in women's. Okay, so first of all, when we look at the slide, so from top to bottom, it actually helps to maintain our brain health. So it helps to keep us emotionally stable. Okay, and then the next one is actually it helps with our blood vessels to maintain our cholesterol level in check. So besides the brain health, it also helps with our cardiovascular health as well. And besides these two important ones, it also helps with our bone health. And also, most importantly, in women, it stimulates the breast tissue or the breast cells growth during puberty as well as during pregnancy. That's why estrogen is actually very essential, especially during pregnancy and puberty as well. And lastly, it helps to maintain the lubrication and also the vaginal thickness. Yes. So estrogen is actually a very good hormone. It makes women looks good, feel good, makes us feel energetic, confident in our skin, as well as it helps to maintain our vaginal and breast tissue proliferation.
Yes, exactly. So estrogen is a very important sex hormone, especially in women, and it gives us glow and health.
Yes.
But just like everything else, if there is too much in excess, especially the free estrogen level in our body, then that is where it may cause some problems.
Yes. Okay, so exactly the estrogen job is actually to tell our cells to grow, to divide, such as our breast tissue, our vagina tissue. Okay, so that's healthy and necessary. So estrogen is definitely essential. Okay, so just like what Dr. Jun mentioned, is when the balance is not in check. Okay, so if the growth signal never pauses, that's when problems arise. So when dividing cells may copy the DNA imperfectly, so that's when the risk really begins.
Yes. So estrogen itself is not like bad or evil to our body.
Yes.
So it's when it become unopposed by the other hormone in our body, which is called progesterone. Yeah, this is a very important sex hormone in women to tell the estrogen to slow down and not to stimulate in excess.
So just now we mentioned that when there is loss of balance or too much exposure to estrogen, that's when it becomes risky. So when it becomes risky, so we will actually digest further into what are the situations that will make you more prone or increase risk of breast cancer, or when estrogen is risky. So when we are exposed to unopposed estrogen longer period, so for example, when we have early puberty, let's say before 12 years old, or late menopause, okay, after 55. So this actually indicates the duration of us having this estrogen and progesterone effect is longer. That's why it increases the risk, okay? So early puberty and late menopause. And number two is actually when one doesn't have full-term pregnancy, let's say miscarriages or ectopic pregnancy, because progesterone is actually the pregnancy hormones,
Yes.
okay? So if we don't have full-term pregnancy, it actually increases our risk of exposure to, again, estrogen. And the other factors are such as when we have poor liver health, when we consume a lot of alcohol, okay, or excess sugar, when our body is unable to detoxify effectively, okay, and then lastly will be obese, okay, because when we are obese or overweight, our fat tissues actually act as the source of this estrogen. So fat tissue is actually another factory of estrogen besides our ovary. Okay, so again, estrogen is not the culprit. It's too much for too long. Okay, without any balancing with the friend, the progesterone. That's when it becomes risky.
Yes. So after talking about estrogen, then now we will see the friend of estrogen,
Yes.
which is the progesterone. Yeah. So progesterone is actually the balancing hormone of the estrogen. So when it keep the estrogen effect in balance. So when the estrogen asks the tissue to grow, and this progesterone will let stabilize the growth of the tissue, so that it will not grow in excess. So when they are both in harmony, in balancing, then that is where our body will feel calmer and in balance,
Sleep better.
and also our period cycle will be more smoothly, more regular as well.
Yes. Okay, so what is progesterone? Progesterone is actually produced by the corpus luteum, okay, which is actually the egg after it has been released. Okay, so that little gland left behind after the egg is released is called corpus luteum. So progesterone is produced after ovulation. Okay, so the purpose of progesterone, as everybody knows, is the hormones of pregnancy, is actually to thicken our uterus lining to prepare for pregnancy. Okay, however, if you do not become pregnant or if you do not conceive, it still play very important roles in our body. So besides pregnancy as the main role, as what Dr. Ju mentioned, it helps to stabilize the breast tissue or the breast cells growth. Okay, and number two, it has calming effect on the brain. Okay, by binding to the GABA receptors. That's why this progesterone is actually also known as the calming hormones. It can help us to sleep better. Okay, and lastly, it reduces the water retention in us. Okay, so it also supports our thyroid hormones function as well. So it has various benefits besides supporting pregnancy. So you can actually realize that when the progesterone is low, one will become anxious more easily, and also one's sleep won't be so good quality,
Yes.
and one can feel more swollen breasts as well as more bloated with heavier periods. So progesterone is the hormone that keeps all this in check.
Yes, true. That's true. So that also tells us again that estrogen and progesterone must be in balance to keep us feeling well. Yeah. So then at the right side of the slide, you can also see we will talk about bioidentical progesterone versus the synthetic progesterone. Yeah, this is very important to know about their difference. Okay, so first, bioidentical progesterone is actually actually also a synthetic hormone, but then the structure, the chemical structure is exactly the same as the progesterone structure in our body. Yeah. So when we take this bioidentical progesterone, then it will act exactly like our natural producing progesterone hormone and bind perfectly into our progesterone receptor and give all the good effect of progesterone. But in another hand, synthetic progesterone, which always used in like contraceptive pills or hormone replacement therapy, this is a bit different. Yeah, the chemical structure is a little bit different from our natural body producing progesterone. So it do not fit to the progesterone receptor like what our body does, and it may act on the other receptor as well, hormone receptor like cortisol receptor or other receptor, which will give us other side effect. And this is where it will lead to like mutinous, or there's a high risk of like breast cancer as well.
Okay, so there are actually many studies, okay, years ago that show that there is an increased risk when that is associated when one is using this combined, okay, progestin and also estrogen, but not from estrogen alone. And also there are many studies that actually support that supplementation with natural progesterone and also estrogen might even be protective against breast cancer. So that's what Dr. Drew mentioned, bioidentical hormones, okay, progesterone and estrogen, which are naturally, okay, similar to our natural hormones, may be even protective to breast cancer when imbalanced. Okay.
So we have talked about estrogen and also progesterone. They work together like sister and brother, okay, to keep us in balance. But other than sex hormones, there's actually another very important component as well, which help to balance this hormone in our body, which is called sex hormone binding globally, SHBG. Yeah, so Dr. Melissa, can you tell us about the SHBG and how it balances the hormones?
Okay, so sex hormone binding globulin, as the name suggests, is actually a protein that is produced by our liver to bind the sex hormones. The sex hormones here actually refer to estrogen and testosterone. Okay, so hormones are bounded to this SHBG so that they are not freely active. Okay, so when they are bound, okay, they remain inactive. Okay, so only a small percentage, about 1 to 2% of these hormones are actually free and active in your bloodstream. So this SHBG is like a school bus. So imagine if the school bus is actually full, okay, that means we have high SHBG. The hormones are all sitting quietly in the bus, okay, no free roaming, no creating messiness or chaos. But when the SHBG is low, means more hormones are actually freely in your bloodstream, okay, creating a lot of problems. Okay, so that's how SHBG, which is the protein that helps to regulate these sex hormones. So we have to keep our SHBG higher in our body, okay, to keep the hormones in check, like to bind them so that they are not freely active in the bloodstream. Yes.
Yeah. So yes. So here is the important point. So that the more healthier the liver are, the more good metabolism that we have, then our body can produce more good SHBG and to keep the hormone in balance and more calm.
Okay, so just now we talked about this bus concept. So what actually, just now we also mentioned that we have to keep our SHBG at higher level. So there are several factors that can actually make our SHBG, which is the protein in our blood, remain low. So for example, okay, if you constantly take in a lot of sugar or carbohydrates, refined sugar, this can actually lower our SHBG as well. Okay, so no refined sugar and also no carbs. Okay, but take more whole food, no processed food as well. Okay, and number two is actually insulin resistance, or if you heard about PCOS, polycystic ovarian syndrome, okay, which can also lower our SHBG level. Okay, and then the subsequent one will be obesity or overweight, poor liver function, stress, okay, lack of sleep, chronic inflammation, as well as if you have been consuming a lot of alcohol, chronic alcoholism, because that can actually lead to poor liver function, which is actually the factory for SHBG.
Yes.
So all these factors can actually reduce or lower your SHBG in your blood, which will then make the hormones more chaotic. Yeah.
Yes, exactly. So, yeah, Dr. Melissa have tell us that what are the causes that can lower our SHBG in our body. So, how can we improve our SHBG in our body? Is like, yes, we need to take care of our body health, metabolism, so we can do some regular exercises and strength training to keep our metabolism in a good baseline, and yeah, to let our liver to produce more good SHBG, and also we need to maintain our thyroid health as well, maintain a good thyroid level, and also to reduce like refined sugar, processed food, yeah, and to take more high fibrous meal, whole food, yes, and also we can take like a supplement, yeah, like selenium or magnesium that can support our metabolism and thyroid function as well.
Okay. So yes, when we help patients to actually boost up their thyroid functions, okay, and also improve their insulin control, okay, and also improve their liver detoxification function, we're actually not just helping with the metabolism, the weight, or the energy, but we are actually helping to protect their sex hormones effect as well, which is actually protecting the breast and also balancing the sex hormones. So to summarize that, sex hormone binding globulin is actually the hormone safety net. Okay, so it controls the sex hormone balance. So a healthy liver will actually promote higher SHBG. That means make your SHBG level higher. So stronger SHBG will mean the hormone balance is better. So less symptoms and also lower risk for breast cancer.
Yes. Next, we will talk about how weight and also breast cancer risk is related. So we know that in women, our estrogen is produced by like our ovaries, but other than ovaries, fat tissue is another factory that produce estrogen, especially after menopause. That's the one of the main sources of estrogen. So with the more weight, more obese you are, there will be more adipose tissue, even more visceral fat. Yeah, so all this fat tissue can convert into estrogen. Yes, and also at the same time, we know that when someone is overweight or obese, there will be more inflammation in our body. Okay, so all this chronic inflammation can slowly damage our body cells and also the DNA repair. Okay, and that is where our normal cell, there will be a higher risk to turn into cancerous cell. Okay, and at the same time, because of this obese, this adipose tissue with the fat and also ongoing chronic inflammation, this can also lead to lower SHBG in our body, which lead our body to expose more to free level of estrogen. Yes.
And so that's why we often observe that menopausal women are linked with obesity. Okay, so we would encourage them to actually try for reduced visceral fat, because even a 5 to 10% of weight reduction can actually help to improve the SHBG level and also lower the estrogen level, improve the insulin sensitivity, so that the hormones are kept in check. So the key is actually to improve the metabolic health, which is by eating whole food, no processed food, and then for exercising, light exercises at least 30 minutes a day, and then sleep well, and also manage your stress well. So through these lifestyle changes, you can actually keep your hormones in check. Okay. However, there are actually some instances where even with lifestyle changes, the hormones are still chaotic. That's when actually we need doctors to come in and actually do a thorough blood test and see whether bioidentical hormones can actually help to balance out your hormones.
Yes. So with 5 to 10% weight loss, then actually already good enough to reduce your breast cancer risk. Okay. So now next we'll move on to like menopause. This is a stage which every woman will experience when they come to certain age. Okay. So this menopause often bring like confusion or fears to the woman because they always experience a big transition in their mood, their sleep. Yeah, then it can be very challenging to them. But if we understand about menopause, then we can overcome this period in a more smoother way. Yes.
Yes, so just now Dr. Jun mentioned that every woman will actually undergo this stage of menopause. But menopause is not something that should be feared of. Actually, it's the transition part that is actually giving more symptoms. So we just have to get through the transition smoothly. So during menopause, our ovaries actually gradually will stop producing the hormones. Okay, and first hormone to drop is actually the progesterone. Okay, so when the progesterone starts to drop, it can actually cause the PMS type of symptoms, such as the one depicted in the slide. Okay, such as headache, okay, hot flushes, insomnia, weight gain, okay, mood changes, irregular period, night sweats, okay, breast tenderness. Okay, that's when the progesterone drops first. Then later on, the estrogen will start to follow as well. So when estrogen start to fluctuate wildly before settling low, that's when the PMS symptoms is getting more and more. Okay, so during this transition period, through bioidentical hormones, it can actually help to make sure that the patient can transit throughout this hormone fluctuation more smoothly. Okay, so the transition, it can be tough, we understand that, especially if the sleep and stress aren't well managed. Such as I have patients telling me that they have very bad mood, they are emotionally unstable, they have night sweats, they feel that everything is so irritating to them. So it's just the transition part that we have to help them to get through, which can be achieved through bioidentical hormones. Okay, so menopause actually, if you say that menopause, it doesn't link to breast cancer directly, but it's the hormonal change which is associated to menopause, which can increase the risk, especially through estrogen exposure, just like what I mentioned. And also, Dr. Ju mentioned that menopause is linked to obesity.
Yes.
Okay, so after menopause, the fat tissue will become the estrogen factory. That's when actually higher circulating of estrogen after menopause, that means more exposure, will actually increase the risk of breast cancer. So we just have to keep this part in check. Okay, so we have to reduce your visceral fat, maintain your insulin sensitivity, increase your SHBG through lifestyle changes, through hormone supplementations.
Yes.
Okay, because menopause and obesity are actually 100% often linked together.
Yes.
So we have to tackle the overweight problem first, because the fat tissue is the one that's actually causing problem.
Yes.
Okay. So how do we actually support the body safely through this transition period that is so, how we say, very disturbing for our patients? Yes. So Dr. Jun, do you have any ideas?
Yeah. So there is a few things that we can do by ourselves at home. Like first, you can eat something that is benefit and to support our adrenal health and liver health. Because adrenal is actually a small gland on top of our kidney. It's one of the organs which produce estrogen as well, especially after menopause. Okay, liver is the organ to metabolize our sex hormones. So by supporting the health of these two organs by such as taking broccoli or cabbages, it can help our adrenal to produce a good balance of hormone and our liver to metabolize the hormone more well and keep the hormone more in balance. Okay, and also next we can also need to keep our blood sugar in a steady level, because just now also we talked about insulin resistance lead to low SHBG and then to increase the breast cancer risk. So by means of taking less refined sugar or processed food can keep our glucose level in a more stable level. Okay, and also thirdly, we need to exercise. Okay, you can do like brisk walking, exercise at 15 to 30 minutes every day, or do some core muscle training. Okay, to improve our insulin sensitivity and also to boost our metabolism. And fourthly, also need to manage our stress level as well and have a good sleep, because when our body is in a high stress level, it will produce a hormone called cortisol. And when our cortisol level is high, it can lower down our progesterone level, and this can cause the imbalance of our estrogen and progesterone level in our body.
Okay, so we have to take care of our diet, no processed food, no alcohol, then keep our sugar in check, and also take care of our sleep, stress, and lastly, exercise, right? Okay, so what happens when all these lifestyle modifications doesn't bring big changes? Okay, so that's when we consider bioidentical hormone therapy. So which is what Dr. Jun mentioned. Bioidentical hormones are actually hormones that are naturally identical to our body natural hormones. Okay, so it won't give side effects. The problem is not the presence of hormones in our body, it's actually the balancing. So when we supplement these hormones through bioidentical hormone supplementation, it's actually to restore the gentle balance that our body has lost throughout the aging process. Okay, so now maybe some of you are wondering, if we are adding more estrogen and progesterone, aren't we adding more breast cancer risk as well? Yes, we are actually reintroducing hormones, but in a controlled physiologic way, natural way we say, to restore the gentle balance. So we are not actually overfilling. We are actually just replacing what is actually lost through aging, through the natural aging process of menopause. So the problem in the past has been often linked to synthetic hormones, such as the progestin, which are not, or which do not behave as our natural progesterone, and that could actually overstimulate our breast tissue. That's why we suggest the usage of bioidentical hormones such as estrogen, progesterone. Okay, so bioidentical hormones actually protects the breast. Okay, it actually tells the cells of our breast to mature and keeps our estrogen situation balanced. So that's what our natural hormones actually does. So it's just replacing back what is lost. And just what I mentioned, there are a lot of studies in Europe actually says that bioidentical estrogen with natural progesterone do not increase the risk of breast cancer. So what matters most again is not about the presence of hormones because we are born naturally with the hormones. Okay? So it's actually protective when the hormones are in balance, in check. Okay? That's why we pair BHRT with lifestyle always, with our diet, with liver support, okay, because that's the SHBG factory, and also monitoring. When done correctly, bioidentical hormones can not just relieve the symptoms, but it can also give other benefits such as bone health, brain health, and also, most importantly, improving the quality of life of our patients.
Yes, exactly. So, okay. So after understanding how our hormones and also body weight and also like our menopausal status can affect our breast health, now re-emphasize again, maybe we can re-emphasize again to our audience like how can we do to reduce the risk of getting breast cancer in our daily life. So firstly, just like what we mentioned again and again in the previous slide, is we need to maintain healthy weight and also a healthy diet. Okay, so because food is the things that we take into our body, and what we take can actually affect our body, whether it health or it become inflamed. Okay, and also when our body is inflamed, everything will become chaotic. Okay, so what we can take in our daily life is we can take multiple type of color of vegetable, such as like broccoli or mushroom, like berries, like flaxseed or omega-3 rich food like salmon or chia seed. Okay, this can help our body to produce the good estrogen, okay, metabolites, and also help our liver to flush out all the harmful things. Okay, and also like anti-inflammatory food like turmeric or green tea can also help to fight the inflammation in our body. Okay, and limit alcohol intake, limit refined sugar and processed food, especially trans fat food. This can reduce our body inflammation as well. And thirdly, also we need to maintain our good body weight, especially our visceral fat. Okay. Then, and next one will be exercise.
Yes, so just now Dr. J has mentioned about diet. Now let's move on to exercise. So exercise can also help to increase our SHBG, which is our sex hormone binding globulins. So exercise doesn't just stay at the level of burning calories because it brings other extra benefits such as improving our insulin sensitivity, raises our SHBG, which is the main one, lowers our body inflammation, as well as when we are exercising, our happy hormones are actually released, so it makes our mood better, it makes us happy as well. However, here we are not actually asking you to go to the gym 7 days a week. So just light exercises such as walking, brisk walking, swimming, or yoga, light weight and stretching workouts actually is sufficient. So 30 minutes a day will actually help to change your metabolic hormones. Because when the muscles are metabolically active, it can help to control the fat tissue, which is our estrogen factory. So in check, so we have to keep our muscles active all the time so that the fat tissues or the estrogen factory won't take over. Okay, so exercise is good, not just burning calories. It brings other extra benefits that our naked eyes can't see. but we can actually feel it through our overall well-being and quality of life.
Yes. So the next one will be like stress management and also getting good sleep. Okay. So like what we said just now earlier on, when we are in stress, our cortisol level will be higher, and this can lead to lower progesterone level. And with lower progesterone level, it can lead to more unopposed free estrogen effect. Okay, when this happens, then our body will feel like off from mood swing to insomnia. So by how to reduce the stress level or cortisol level is you can do something like deep breathing or something relaxation like stretching or yoga. Okay, and also maybe you can take some food from some supplement that can calm your mind. Okay, and also you need to have a good sleep. Okay, try to sleep in darkness and aim for 7 to 8 hours of sleep as well. This can help our brain to rest and calm our body, allow our body to repair and also produce melatonin. Melatonin is also one of the very important hormone in our body for rest and also for anti-inflammatory. If let's say this or this practice is not very useful, doesn't give a very good effect or improvement, then you can aim to take like bioidentical hormone like melatonin or get some other supplement like magnesium or like ashwagandha as well to help to calm our mind and to help with our sleep.
So Dr. Ju has mentioned something that is very important: stress management and also good quality of sleep. But what if one cannot avoid this, such as a businessman or businesswoman who has to work 24 hours a day, not enough sleep, has to go for social drinking, okay, and they don't have time for exercising. So of course, we would advise patients to have healthy diet, okay, exercising, stress management. But what if they can't really comply to this? So that's when our doctor's role is very important, when bioidentical hormones, as what Dr. Ju mentioned, actually plays a very important role in helping patients to reduce the body inflammation and keep the hormones in check. Okay, so the hormones that are essential in this are actually such as the estrogen, natural progesterone, and also natural thyroid supplementation. As what everybody knows, thyroid hormones is a hormone that is very essential to increase our body metabolism. Okay, so by increasing our metabolic hormones, it can actually help to improve our insulin resistance as well. That means increasing our insulin sensitivity and then reduce our body inflammation and improve our SHBG level. So hormones are like a team, okay? So it's not just one hormone that's essential. Actually, all hormones, they work together. So when we want to support or balance out the hormones, we need the team. So keep the team well fed, well rested, and well balanced. And in this area, we will actually focus more on thyroid hormones, estrogen, and also progesterone. The key is actually to balance them out, not to actually overfill them or make them more unbalanced. That will create more problems.
Yes, exactly. So other than all the things that we mentioned earlier on, we do not forget our gut health as well, because this is one of the first barrier of our body that face the outer environment. So we need to maintain a good health, okay, to help to fight the inflammation in our body, to reduce inflammation in our body. So we can take like high fibrous food or pre and probiotic to maintain the good health and also the good balance of the microbiomes in our
covered most of the important things, explaining that hormones are actually essential, something not to be feared of. So actually should be feared of when it's out of balance, it's unchecked. Okay, so maybe now we can look into, is there any questions in the line that we can help to answer? Okay, so the first question from Shireen. Okay, hormone pill is good to take. Any side effects? Okay, doctor, how we know our hormones balance or not? Any supplements recommended? So thank you, Sherry, for the 4 questions. Okay, let me answer you um, according to the sequence then. Okay, so the first question, hormone pill is good to take. Okay, so there are actually 2 types of hormones pill, okay, we say in the market. Okay, the first one is actually the synthetic one. It's actually the medicinal or the hormone replacement therapy, the synthetic progestins, and the synthetic estrogen. And the other one is the one that we mentioned about bioidentical hormones. So both are actually hormones pill, but they are structurally different, okay? And it actually the structurally different because bioidentical hormones is actually naturally identical to our natural hormones, which actually helps to give a better results and is a safer choice compared to the synthetic hormones. Okay, so it depends on your problem. Okay, so definitely bioidentical hormone is a better choice compared to the HRT because it is safer and it's naturally identical. So any side effects? Okay, so bioidentical hormones replacement therapy. Do you experience any side effects with your own natural hormones? No, right? Okay. However, the synthetic ones are those medicines, so it can give side effects and it cannot be taken more than 5 years. Okay. So these are the answers to answer your question. And the next one, how we know our hormones balance or not. Okay, so it can be checked through a thorough blood check or blood test. So you can actually come to this for a hormone check, okay? As well as at the same time we'll check for your inflammation and nutritional levels as well. Okay, so any supplements recommended? So it's actually based on your blood test result. But if you want to improve your hormones balance, as what Dr. Ju mentioned, you have to keep your liver in check. So there are many supplements that are actually good for liver, such as the antioxidants, okay, the curcumin, coenzyme, okay, which helps your liver to detoxify better. So these are the supplements recommended.
Yes. So there's a question from Miss Tyree Nabila. She's asking if there's a patient suffer from hyper or hypothyroidism, is there any other way to help in increasing SHBG if there is less adequate level detected? Okay, so first of all, we need to know what is the cause of causing low SHBG level. So one of the factor that affect the SHBG level to be low is like low thyroid level, okay, and also like high grade of body inflammation and also insulin resistance in our body. So we need to address from several way and several factor to help to increase our SHBG level. So if our thyroid level is suboptimal, is not at the optimal level, then we can supplement it with like bioidentical thyroid hormone to help to boost the metabolism and to help to boost the SHBG level. And also if there's a insulin resistant condition in our body, then we need to address that factor as well. We can take some like metformin, some medication which help to improve insulin sensitivity. Okay, and also we need to address as the inflammation status as well, like what Dr. Melissa mentioned earlier on. We can take like antioxidant or anti-inflammatory supplements such as like CoQ10 or curcumin to help to fight the inflammatory status in our body. And also we can take like some supplement like micronutrients such as like selenium, chromium, magnesium. This can help to support the thyroid health as well, and also chromium can help to improve the insulin sensitivity as well.
Yes. Okay, so and then I also see that there is another question from Irene. Okay, the question is, can breast cancer patients wear bra? Okay, so definitely, women with breast cancer can actually wear a bra, but the type of bra and when to wear it actually depends on the stage of treatment, and most importantly, it has to be comfortable. Okay, so normal bras are fine as long as it doesn't contain any wire, underwire, or tight fitting. So actually, the general rules for choosing bras for breast cancer patients are: number one, it has to be made from soft breathable materials such as cotton. Okay, and number two, wide straps and bands not very tight fitting and compressing on your skin. And number three is actually don't wear it too tight, okay, or very restrictive, because it can actually cause discomfort, especially because breast cancer patients sometimes they have discharge from the breast, tenderness. So if you're wearing very tight fitting, it can actually cause more discomfort. Okay. And lastly is get properly fitted again after surgery, because after surgery the shape and the sizes of breast tissue or the breast might change. So most importantly is to find the correct size for you after the surgery. So these are the general tips on choosing the bra for cancer patients. Okay, so thank you, Irene, for your question. Any other questions?
I think that is all the questions that we have got so far for now. Yeah, if any one of you still have any question, then you can always drop a message to our phone line or our website. Yes.
So this one is about breast cancer. Okay, breast cancer awareness is not about fear, it's about empowerment. That's why in our website or throughout the month, we would actually encourage every woman out there to actually do a self-examination for breast, because early detection saves lives. Okay, so one can actually screen for this breast cancer or any lumps, swelling in your breast by your own self. Okay, by just following several simple steps at home in front of the mirror.
Yes. So since this month is a breast cancer awareness month, we would like to remind every woman again that we do not need to fear of our hormones. Yeah, just remember that when our hormone is in balance, okay, then that's where our health will be in balance as well. Do not think of our hormones as our enemies. Okay, so so when you understand them well, then you will not fear of them.
So if you would like to learn more about how to balance out your hormones safely, okay, you're always welcome to reach out to us at Rivix Clinic. Yes, okay. So hormones are essential, because without hormones, our life will be chaotic. Okay, so without hormones, we cannot live. If the hormones are imbalanced, our life will be chaotic as well. So it's important actually to keep the balance in check. Okay, that's why monitoring is very important after initiation of hormone supplementation. medications. Okay, monitoring is very important.
Yeah. So remember to share this life topic to the women, like your sister or your best friend around you as well. Can always share the knowledge with them so that they can understand their body better as well, and also remind each other to do screening in regular, okay, and support one with another. Okay, so
Yes.
I think this will come to the end of our live session today. Thank you for everyone joining our live this afternoon.
Yes, so thank you everyone. Yes.
See you again at next live.
Yes, okay, so bye for now. Happy Pink October to everyone.
Yes.
Okay,
Okay.
bye.